We at RAND have come out with a new report which focuses on the reconstruction of Haiti, but not the immediate aftermath of the earthquake, but providing some advice about where Haiti could go in order to create an environment for sustainable growth. And our report came out along with everybody else. We were very horrified at the results of the earthquake. We really thought, how can we help? And so much of the international effort was focused on humanitarian assistance. And we said, well, let's step back. Here we've had a devastating earthquake, but other countries have had earthquakes too, and it hasn't killed 300,000 people. It hasn't made over a tenth of the population homeless. What is it about Haiti? How come the results have been so horrific? The focus of the report was not how can we get tents in quicker, or how can we get food to people. It's going, how do we help the state to function like states do elsewhere?
What we've done here is to examine all of the pre-existing plans and proposals and initiatives in a variety of key areas, and to look at ways to improve upon and build on those plans rather than reinventing the wheel. And
so we said, well, in order to prevent a repeat of the disaster, what are some really concrete recommendations that the government, which has been weak, this is one of the best governments Haiti has ever had, but what should it be focused on? And with this big influx of billions of dollars of aid, where should that money be channeled so that Haiti has a bright future? What's more important than money is systems. Roughly $10 billion or more has been pledged by international donors for Haiti. This is wonderful, but you don't want to spend it tomorrow. You don't want to push to get it out immediately. What you do want to do is think about how you can create institutions to make sure that you create a basis so the Haitians don't ever need this money again. And so our push in the report, and it's consistent, I think, with both what the Haitian government wants, international donors have harked upon, is that don't do a project unless you're sure that it can be maintained and will be maintained. It's not the school, it's not the hospital. It's creating a healthcare system, it's creating an education system, it's creating a road system which will be there tomorrow and next year and the year after. Our bottom line message is that for every public service that the Haitian government should be involved with, the international community needs to work with them now to create institutions in the Haitian government where they can start providing that service. And so when we talk about health care, 80% of health care in Haiti is provided by either private doctors or clinics or non-governmental organizations or charities or whatever. We actually say the government should stop providing that 20%, turn it over to these groups, but start creating an ability within the Ministry of Health to go out and make sure that that clinic is providing proper medicines, that the doctors really know what they're doing, to provide some standards and some oversight. So instead of trying to do something they haven't been doing very well anyway, stop doing that and start focusing on what they can do. And so the whole focus of our report is that from policing to education to health care to business registration, it's time for the government to stop doing things it does poorly and really to try to focus on doing a few things well.